All right. Thank you so much, Denise. Can you hear me okay? Super.
Yeah.
Thanks. This is a topic that's near and dear to my heart, something that I have spent a lot of time working with over the years, and I'm happy to share this with you today. It's often referred to as buyer's remorse. When someone joins Medicare, a Medicare plan, and in the fall, during the annual election period, and then realizes they don't have exactly what they want to have for the year going forward. So it's a kind of a little get out of jail free card. So thanks for joining us today. I'm glad we're recording this because we get calls on this topic, and it's important to be able to share this information with everybody going forward. So again, thanks everybody for joining us. For those of you who are not familiar with the Office of the Healthcare Advocate, we've been around for about 25 years. We are an independent state agency. On the call today with us, actually, we have one of our most senior members, one of our nurse consultants, but our PAC, if you will, at the agency here is staffed by 18 of us. We have nurse consultants, attorneys, paralegals, and other professionals who are highly skilled at helping people choose insurance as well as making sure that when they have insurance, they have access to services. And when that access is disrupted or interrupted, our team jumps into action to help consumers, healthcare consumers, to to resolve those issues. And if there's been a denial or a reduction in services, we help to remedy that. Our services are free of charge to the consumer, and so it's an open door, open access. We're here to help agency, and we're very proud of the work that we do here. So today we're going to look at the third highlighted option here, but I thought I would give just a brief overview of the four types of Medicare enrollment periods. There's the initial enrollment period when you're first coming on to Medicare. And typically that enrollment period lasts for 7 months. It's typically the first 3 months before someone's 65th birthday month, the birthday month itself, and 3 months after the birthday month. This is when you are to enroll in Medicare. There are certain circumstances, the greatest one being someone continues to work and through that active work of their own or a spouse, they have insurance and then they can legitimately delay signing up for Medicare for the first time. But that initial enrollment period is essentially a one-time getting into Medicare enrollment period. Then we have the Medicare annual election period. Sometimes people call this open enrollment period. It's every year, and it's not typically a time when people start Medicare. It's a time when they have an opportunity to change their Medicare option for the next year. So every year between October 15th and December 7th, there is the annual election period. A lot of people ask me, why does it end on December 7th? Well, it takes about 3 weeks for Medicare to move all the pieces around and get all the changes in place so that on January 1st of the next year, then people are off and running on their new plans. So in order to do that, the annual election period for Medicare typically ends on December 7th. The other thing that I'll just say about that annual election period is people change their mind about their plan a lot between October 15th and December 7th. So if you're in Medicare and you have that you've made a choice, you can change your choice without any issue up until December 7th. On December 7th, your choice locks for the next year. And then we have what we're going to focus on today, which is the Medicare Advantage open enrollment period. This enrollment period lasts every year from January 1st to March 31st. And this enrollment period is what I mentioned before as maybe you have buyer's remorse. And we'll look at the reasons why people might want to change the plan that they had elected back in between October 15th and December 7th, that choice that locked on December 7th. Every year you can have a choice. It's not a once in a lifetime opportunity. Every year you have a one-time opportunity if you are in a Medicare Advantage plan to change your enrollment. And then the fourth enrollment period I just want to mention are special enrollment periods. These are exceptions to the general rules that I just went through. And for instance, you may have a special enrollment period because you were in a Medicare Advantage plan and you moved out of that plan's um, uh, period where you live. So your network has changed because you moved. That provides you with a special enrollment period. So there are a lot of these. We can go into a lot of, if you have specific questions on the other types of enrollment periods, we can discuss that when I'm through with the slides. But for right now, we're going to focus on the enrollment period that we're in currently because we're in January and this is a period that will last through March 31st. So again, the Medicare Advantage open enrollment period, who is it for? It's for individuals who choose a Medicare Advantage plan during that election period that I just went through, the annual election period between October 15th and December 7th. And you have a one-time chance to do one of two things. You can either change to another Medicare Advantage plan. So if on January 1st you started with a Medicare Advantage plan and you want to change, you can change to another Medicare Advantage plan, or you can change to traditional Medicare. And then you can get a Part D prescription drug plan that goes with traditional Medicare that you may have had combined with your Medicare Advantage plan that you were in. So you can get a standalone prescription drug plan, and you can also pick up a supplement plan. So you have the full complement of traditional Medicare if you choose to go from a Medicare Advantage plan to traditional Medicare. And whatever change you decide, it's effective on the first day of the next month. So if on January 31st you say, I'm going to change my plan, then it's effective February 1st. If you make a change on February 1st, it'll be effective March 1st. So it's always effective the first day of the next month of your choice. So why would you want to change your election that you had made last year for this year? There's a number of different reasons. One is that you realize your Medicare Advantage plan network doesn't include your practitioners. For whatever reason, either the materials didn't catch up and your provider is not in the network of the Medicare Advantage plan that you're in, then you may want to change to another Medicare Advantage plan or traditional Medicare that your practitioner is participating in. Another reason is that maybe your medications are not included in the Medicare Advantage plan. Sometimes Medicare Advantage plans change their formularies, the types of medications that they have, and you might not have realized that your medications are no longer covered under the plan that you chose. So now you want to change your plan. I will say with regard to medications, there's something called a transition refill. And in a transition refill, even though the plan may not be covering for the next year, there's a transition of 30 days. So you may not realize that your medication is not fully covered until February, because in January you went to the pharmacy, you got your medication, and they filled it for you and it was paid because of this concept of a transition refill. Doesn't mean that it's going to be covered in the future. So that's why you have the 3-month period to make these adjustments at the beginning of the year. There are other reasons why you might want to change the election that you had last year. You may have been impressed by the low premiums that were offered by the plan, but now you realize there are significant out-of-pocket costs. So maybe the premiums aren't that high, but for the services that you use, you're spending more out of pocket than you would if you went with another option. Um, the, the obvious one is your needs have changed. You now have been diagnosed with something else and you need to see a specialist. And the specialist that's recommended to you is not in the network of doctors in the current plan that you're in. So now you want to make a change to another plan or traditional Medicare because you can see those doctors under those circumstances. Um, uh, uh, Another common kind of issue that we hear about is being misled by unfair marketing or broker claims. You may have been promised that you were going to get a certain extra benefits under a plan that are not materializing. And so you decide that it's time for me to make another choice. So remember that it's your right to make a change. You don't have to tell anybody why you're changing. You don't have to give them an explanation. And you can just say, I want to change. And it could be just because you don't like the name of the company. Who knows? It's your choice, and you don't have to provide an explanation for making a change. So let me just go through quickly what you're not able to do during this Medicare Advantage open enrollment period, or as we sometimes refer to it, disenrollment period. So if you had elected traditional Medicare in the fall annual election period or fall open enrollment, you cannot make a change. If you had elected traditional Medicare now and it's January, you can't decide, I want to go to a Medicare Advantage plan. You have chosen traditional Medicare, you are in traditional Medicare for the remainder of that year, unless you have what what I referred to as a special enrollment period, a reason that would allow you to make a change. Also, if you are in traditional Medicare, you can't change your Part D prescription drug plan. So what that means is, and we've had people call and say, "Oh, I'm in a prescription drug plan and I really don't like it. I want to change my prescription drug plan." If it's a standalone Part D prescription drug plan, you don't have an option to make a change. Only if you are in a Medicare Advantage prescription drug plan. That's a combined plan, the Medicare Advantage services with the prescription drugs, and you move to traditional Medicare, then you can pick up a Part D plan. But if you had already chosen a Part D plan, you can't choose another Part D plan. And also, it's important to note that in Connecticut, we have supplement plans that are continuous enrollment, which means on a month-to-month basis, you can change I'm sorry, not a prescription drug plan, a supplement plan if you are in traditional Medicare. So, and then the final point on this is about join. If you had not secured a Part D prescription drug plan during the annual election period, and now it's January and you want to pick up a prescription drug plan, you want to join a standalone prescription drug plan, you cannot do that. That's not part of this enrollment period. So that kind of gives you the parameters of what you can and can't do and why. So that's the brief update on what's happening with the Medicare Advantage open enrollment period, and happy to have any kind of conversation or questions or discussion that anybody might have with regard to that information or anything else, because we're here. We can chat.
And you can also put your questions in the chat and we can respond that way as well.
And there's Jill Hall, our star nurse consultant. And hello to Walt Saplinski. Nice to see you, Walt.
Okay. If there are no questions, please, our information is up on the screen here. You can call us toll free, you can email us. Um,
Oh,
and ask Walt.
oh, yes, thank you. I do have a question. First of all, thank you, Kathy. This is very clear. It's nice to see you again, and I appreciate the greater outreach that you're trying. I do have a question. What was presented today was for individuals, and I didn't know if some of these things applied as well to egg whip groups.
That's a great question, Walt. So, and Walt is one of the leaders in for the Connecticut teachers, and the Connecticut teachers have for their retirement plans something called an egg whip, which is the employer group waiver plan.
Mhm.
And an employer group waiver plan is a customized plan for specific groups like teachers. So they have their very own rules, and those rules are different for enrollment. As well as for a number of other things. The Centers for Medicare and Medicaid Services have given these employer group waiver plans waivers for that very reason to
Mhm.
make their own decisions. So, unfortunately, these particular rules do not apply to employer group waiver plans. They apply to most other plans other than those customized plans for
Okay.
groups. Yeah,
All right. Well, thank you
sorry.
very much for that answer. Okay. Thank you, Kathy.
Thanks, Walt.
Hey Kathy, there's a question in the chat. Let me read it to you. If you
Please.
use hospital days under the Advantage plan, do those days count against the traditional plan?
I'm sorry. I didn't hear you clearly.
Oh, okay, it's from Michelle.
Hmm.
C. If you use hospital days under the Advantage plan, do those days count against a traditional plan?
Yes. So if you're moving from one plan to another, you can't get, for instance, Medicare will cover 90 hospital days for a benefit period. And if you say use 80 of those days in one for one type of plan and then you move to another plan, they will coordinate. So you only get the 90 days, and then of course you can use your lifetime reserve days, but there is a coordination. You can't move and then start all over again.
Michelle, does that answer your question? Perfect. Oh, no problem. Perfect. All right. So if there are no other questions, again, email us and give us a call. Thank you everyone for coming, and we'll see you for the next Lunch and Learn.
Can I just want to
Sure.
shout out to Walt. Walt, if you would please contact me
Okay.
directly.
Okay.
My email is just kathleen.holt@ct.gov. I'd
Okay.
like to chat with you about some things
Okay.
we've got going on.
Okay. Thank you very
Appreciate
much.
it.
I
Thank
appreciate
you.
that. Okay. Stay warm if you can.
Thank you.
Thank you so much.
Take care.
Okay. Bye.
Bye-bye.
Bye. Bye,
Out
everyone.
of here.